Did they make the right call?
Absolutely. Absolutely. Our country is the leading system in the world in terms of transparency and doing it the right way. Our country was the leader in the world 2 decades ago on GMOs when there was hysteria around the world. And now we're very happy with our food supply. There is no problem. They are doing the right thing. It's these processes that hopefully will turn people who are vaccine hesitant to vaccine confident. So I think they're doing a great job.
Street's trying to make sense of it, obviously. There's a couple notes out from Morgan Stanley, for example, and from J.P. Morgan. Fred, not only saying that the adverse event rate appears extremely rare, but in the words of JPM, we would not be surprised to see J&J vaccinations resumed once the risk associated has been adequately communicated. Do you think that's possible?
Well, it's only, we certainly feel for those who have been affected. And we do not know if the vaccine is the cause of the effect, but we do feel for those. But it's 1 in a million. And one often wonders, had it not been for the issues around the AstraZeneca vaccine in Europe, which is also an adenovirus vector vaccine, would there have been this kind of scrutiny on the Johnson & Johnson vaccine? The numbers are very, very low. And if you just look at the benefit of the avoidance of serious disease, hospitalizations, intubations, and death versus a 1 in a million, you can see why this vaccine is a very good vaccine.
Yeah, Fred, I get this is very rare, and I get we need to put the context around it. Absolutely. But the fact that we've seen these vaccinations in general roll out as quickly as they have, faster by a magnitude of years versus previous vaccines treating other types of illness and diseases over the decades, I think there's this concern out there about how much the data longer term is going to yield, just the fact that we haven't been able to give time given how quickly they've rolled out. So how would you respond to folks that are maybe perhaps already on the sidelines or concerned and want to see more information, more time go by now that this is happening?
I'm not surprised that this happened, given the massive pressure that people were under. And that's why the emergency use authorizations were necessary. But the good news is that the signaling systems that we have now versus 10 years ago or 20 years ago are fantastic. News travels very, very quickly. So we can go forward with the confidence that the authorities are looking at this very carefully, exchanging data across the Atlantic, which is great. And I think we should feel very safe. And the good news is that we're getting pretty close to getting our lives back, because we will get to herd immunity within the next 3 months.
Yeah, but Fred, I wonder, stopping a usage for 1 in a million adverse cases, you seem to think it will actually help build confidence, but there are others who believe it actually will help build hesitancy, because those who are afraid will point to this very fact and say, you see, we told you so.
This is the sad part, and that's one reason why only half the population gets the flu vaccine every year. When the data is so overwhelming, it's these kinds of news that seem to feed it's the confirmation bias that people have. And we just have to find more around the messaging element here, because I think that's our biggest challenge as we go forward.
Right. But what about the right balance then? I mean, because you've kind of, just listening to you just now, you've been on both sides of this. You still think, though, the FDA and the CDC have done the right thing here in pausing this?
I really do believe that they are doing the right thing, because open dialogue and open science really trumps the allegations that things are being held in secret. It just feeds conspiracy theories. So I think the FDA is approaching this in absolutely the right way. Janet Woodcock is one of the best scientists at the FDA, and she leads the FDA.
So Dr. Woodcock is speaking right now, even as we're having this discussion, acting FDA chief, and says, Fred, on the call that they only expect the pause to last a matter of days. So assuming that's true, what would you expect the communication to sound like when they resume?
I think what they should say is that we have taken the data. We are watching these events, that the amount of data as a part of the total population is very, very tiny. So it's hard to separate it from the overall events in the population. but we're going to keep monitoring this closely. But the overall benefit is overwhelming. The ability to avoid going to a hospital and possibly dying, it's incredible. And the fact that our lives can come back and our economy, which is losing hundreds of millions of dollars worth of value every day, will also come back. So tremendous benefit here.
Shepard Smith here. Thanks for watching CNBC on YouTube.